Hi, I'm Anita Kou, and I'm a rehab physician and spinal cord injury medical director at the Northwestern Medicine Marianjoy Rehabilitation Hospital. Wheelchair and positioning services are a specialty focus area that you'll only find at your top-tier rehabilitation hospitals. Marianjoy is one of just a few healthcare facilities in the Midwest that provides wheelchair and positioning services to both adults and children.
My name is Kathrina Prostka. I am a physical therapist and assistive technology practitioner at Northwestern Medicine's Wheelchair and Positioning Center at Marianjoy. We provide a multitude of services, ranging from the evaluation and recommendation of equipment, the fitting and modification of devices, working on adjusting or repairing equipment, training a client to use their device appropriately. Devices range from wheelchairs through bathing equipment to walking devices, all the way up through high-tech equipment that patients need to function independently.
Most of the therapists who work in the wheelchair and positioning clinic are either physical therapists or assistive technology professionals, and those are individuals who've gotten their training and certification through the Rehabilitation Engineering and Assistive Technology Society of North America, or RESNA. These therapists are experts in recommending any custom assistive technology for fitting and also navigating the process of obtaining that for patients. For individuals who have just been given such life-changing diagnosis, and then for them to be told now they got to use a different device to be independent, yes, it can definitely be challenging.
An evaluation in the wheelchair clinic begins with a conversation with the patient to talk about their medical and their functional history. Why are they coming to us? What makes functioning in their daily lives difficult? We then delve deeper into the different areas of physical therapy assessment, things like posture, range of motion, sensation, strength, as well as then talking about what is it that they want to be able to do better, to match a piece of equipment with that patient's goal. We then bring in equipment for the patient to trial so that they can get hands-on experience with it. And then the therapist in the clinic will handle the documentation for the third-party payer, the insurance plan. The funding for assistive technology, such as wheelchairs, is constantly changing. The therapists in the wheelchair clinic are always learning about new trends in reimbursement or changes in funding that will cover the equipment we're recommending. Our job in the clinic is to be the advocate for the client, to create the documentation for an outside company who knows nothing about this individual to read through and understand why we are recommending this device for them. We will help the patient from the evaluation until we've exhausted all our options for funding. Every product that comes out of the wheelchair clinic is customized to the individual in some way. Even though a product might be an off-the-shelf wheelchair, we are adding or interchanging components on that chair to make it unique to the individual. We oftentimes create a one-of-a-kind seat cushion or back support for that person. The Wheelchair Skills Training Program at Marianjoy was created to fill a gap in our service line. We recognized that we are making recommendations and providing patients with equipment, but not giving them the education and training so that they can successfully use this equipment in all environments.
Having them practice more real-life situations where they're navigating across curbs or, slippery surfaces or more barriers, that is very useful for our patients to kind of get that type of real-life practice.